So air abrasion is almost like a small little sandblaster that's on your teeth, but it can get away, it can remove aggressive staining on your teeth, but it also is a way for us to be minimally invasive, that where we can remove small little areas with air abrasion and then maybe just put a little sealant over top of it instead of actually having to drill completely into your tooth and removing a lot more natural tooth structure. So it helps with the staining. It also helps with cleaning teeth. So we can use it in a lot of different fashions. I use it almost every day in what we're doing, but it helps it from a minimally invasive approach. Silver diamine fluoride is a conservative way for us to stop tooth decay. It's a small fluid that we can put on the teeth that in certain circumstances can stop the progression of tooth decay. So if you have a small baby tooth on a child or something, they've got a little bit of decay there, sometimes we can just place the silver diamine fluoride over top of it to stop the decay until the tooth's ready to come out. People that are more prone to decay, we can apply that to their teeth to help the decay not spread as fast. So sealants are great to help seal up the grooves of teeth. So when permanent teeth come in, the most common place for tooth decay is in the grooves of those teeth. And sometimes the grooves of the teeth are smaller than the bristles of a toothbrush. So you can brush your tooth all you want, but that bacteria can still get down into the grooves of those teeth. So we usually recommend sealants to seal over top of those grooves so they're not so deep. That way when you're cleaning everything, all the bacteria gets off of your teeth and it makes you a lot less prone to tooth decay. So a sealant is a protective coating that goes over top of a permanent tooth, and it protects the teeth from decay. A lot of decay happens on the chewing surfaces of the teeth. It's easily applied. We just put a little cleaner on your tooth, wash it off. We can place the sealant on there. We shine a little light on it, and it's all finished. So it's a very easy procedure, very minimally invasive because we don't have to remove any natural tooth structure to help to protect the tooth. So there's lots of different ways to restore a tooth, and a tooth that has decay in it sometimes just needs a filling, sometimes it needs a crown, sometimes we can do an inlay or an onlay for the tooth, which is something that's made out of porcelain that we can make here in the office. With our technology, we're able to design it in-house and we can cement it the same day, and it's a way to restore part of the tooth that was damaged without having to put a full coverage crown around the whole tooth. So it's a minimally invasive way to restore a tooth, but still you get the aesthetics of the porcelain. So anytime I'm looking at a patient and how we're going to treatment plan them, I'm looking at it from a minimally invasive standpoint. Long term, the less dentistry that we do on your teeth, the better, is how I generally want to look at it. So if we can restore your teeth and remove less natural tooth structure over your lifetime, that's going to be much more beneficial.